Really excited to share it. So we know from the first talk quite a bit about the background about suicidality, how suicidal thoughts and behaviours are so much more frequent, and even risk of dying by suicide is so much higher in autistic people compared to the general population. But worryingly, this is very, very under-researched, as also brought up in the first presentation. But there aren't any validated suicidality assessment tools available for autistic adults, and that really prevents us from making progress in this really, really important field. So the Mental Health in Autism project aimed to develop a tool to better identify suicidal thoughts and behaviours in partnership with autistic adults for use primarily in research studies. So the first stage of our project conducted a thorough systematic literature review, looking at what kind of tools have been used to assess suicidality in research, in the general population and autistic adults. And we found that there was no tool with evidence of validity had yet been used in any suicidality research in autistic adults. So no study exploring suicidality in autistic adults has ever used a tool with validity in any population, and there is no tool yet available that's been validated in autistic adults. But we did identify a brief 4-item open source tool that had a range of evidence in support of a number of different psychometric properties in the general population, and it had been widely used in research studies in the general population, and we thought perhaps we could look at this candidate tool and how it operated in autistic adults and how we could perhaps adapt it to better assess suicidality in this group. So in the second stage of this project, we started to explore the measurement properties of the Suicide Behaviours Questionnaire revised in autistic adults to see if we had to adapt it. And we did a number of studies in this stage. One study was an online survey to gather a really large sample of autistic and general population adults completing the SBQ-R to compare the factor structure and how it operated between the two groups, autistic and non-autistic adults. And then we followed that and supplemented it with interviews and qualitative data analysis. Interviews with a subsample of those survey participants, 15 autistic adults, and a much larger Delphi survey of 251 autistic adults to explore how autistic adults interpreted the items of this original tool and inform potential adaptations. So this is the factor structure of this tool, this 4-item brief tool. In the general population, there's strong evidence for this factor structure. And we hypothesized that particular items on this tool could be particularly problematic for autistic adults, particularly item 3, so threat of suicide attempt or communicating that you intend to take your life to others. That could be difficult for somebody with communication difficulties or somebody who's particularly socially isolated, which we know a number of autistic people are, even though they might not be suicidal. And item 4, self-reported likelihood of suicidal behaviour in the future, could be particularly difficult if you have difficulties in abstract future thinking, which we know a lot of autistic people have. So when we did a multi-group confirmatory factor analysis to compare the factor structure between 188 autistic and 183 non-autistic adults matched on age and gender, we found evidence for exactly this. We found that items 3 and 4, as we hypothesized on this original tool developed for the general population, that autistic adults seem to interpret the items differently to non-autistic adults, and it was really focused on items 3 and 4, as we predicted. But was it for the same reasons that we thought that that was the case? And we can't do that with statistics. We actually have to ask people. So we looked at the content validity through a series of interviews with those 15 people who completed the survey, and also we asked 251 autistic adults online through a Delphi survey. And we found really, really consistent feedback about how the problems or difficulties that autistic adults had when trying to interpret and respond to this tool developed for the general population. So for item 1, have you ever thought about or attempted to kill yourself? A lot of autistic people said there was something missing between a brief passing thought and a plan. In fact, many autistic people said that they had attempted suicide without making a plan first, and it was quite an impulsive decision. 2, how often have you thought about killing yourself in the past year? This scale only goes up to very often 5 or more times in 12 months. And a lot of autistic people said, does that make me really bad? Because this is a really small number. It doesn't capture the intensity of the thoughts or the length of time. It doesn't capture my experience of suicidality at all. Item 3, have you ever told somebody that you were going to attempt suicide or that you might do it? A lot of people said, but who would you tell? I don't really have anybody to tell. I'm very, very isolated, or I don't know how to tell somebody. It's hard enough having a normal conversation. But it is an important question, and they wanted us to keep it in, but to adapt it. And 4, how likely is it that you will attempt suicide someday? Lots of autistic people said it's a future question and you don't know what's going to happen. It's really important to ask, but it's impossible to answer. So in summary, this stage showed us that autistic people interpret the items of this tool developed for the general population differently to non-autistic adults. Items tapping into social communication and isolation and abstract future thinking are particularly challenging for autistic adults to answer. And that means, critically, that scores on this tool cannot be compared between autistic and non-autistic people, which is a big difficulty for research looking at prevalence and correlations and comparisons, which is what a lot of our research is about. So the items need to be adapted in partnership with autistic people. So the third stage, which we recently completed, is the adaptation and validation. We used, again, cognitive interviews with the same 15 autistic adults to co-produce the adaptations with them, to test out different types of the questions and to take their suggestions for how we should adapt the tool. And then, again, a Delphi survey with 251, a larger sample of autistic adults, to obtain feedback on that adapted tool. So a large new group of people. And then a validation survey with 289 autistic and 258 non-autistic adults to explore the statistical measurement properties. So what kind of changes did we make? With the first item, we added in that stage between a brief passing thought and a plan. I have seriously thought about ending my life, but I did not plan how or try to do it. And because so many autistic people said I've attempted suicide without necessarily planning it. It was an impulsive decision. I happened to have access to means. We've added some qualitative follow-up questions, co-designed with autistic people to try and capture that, to see if that's more predominantly the case in autistic compared to non-autistic people. We also added in 2 items. We replaced that item 2 on the original 2 with 2 new items, to capture the full frequency of suicidal thoughts in the past year and perseverative thoughts. So when you have intense thoughts about ending your life, how long per day does this typically last, which can go up to more than 8 hours? And also, how often have you experienced intense thoughts about ending your life in the past 12 months, with a much fuller scale that goes up to 1 or more times today, rather than assuming that 5 is most often. And then for question 4, that important question that autistic people had a lot of difficulty with, about kind of future intention to attempt suicide. We've replaced it to make it a little less abstract on suggestion from autistic people. And it says now, when you experience intense thoughts about ending your life, how likely are you to act on them? Because it's a little bit less abstract than, will you ever attempt suicide? And with these visual aids, it's important to note that about 50% of the samples said that these were useful. It's a real kind of you love it or hate it sort of with these visual aids. About 50% of autistic people found them really useful, but the other half really didn't. So it's important to give people the option of whether they want to see these. And then for the last one, about communication of intent and past attempts, we simplified the response options, and we also added in follow-up qualitative questions about, well, who did you tell if you have told somebody? And if you haven't told anybody, why was that? Because that could be quite clinically useful and also useful for research as well. So in terms of looking at the measurement properties of this tool, in the final sample that was around 300 in each group, for the factor analysis, we actually split the sample. So we did exploratory factor analysis in one half and then the multi-group confirmatory factor analysis in the other. So this is the first half of the sample and looking at exploratory factor analysis in 144 autistic compared to 119 non-autistic adults. And we found evidence for one factor structure with broadly similar factor loadings and acceptable, quite high internal consistency for that one factor solution. When we ran the multi-group factorial invariance analysis in the other half of the sample, 139 non-autistic compared to 145 autistic adults matched on age and gender, we did find that a significant difference in the factor loadings between the two groups, but it was isolated particularly to item 2. And that's frequency of suicidal thoughts in the past year. But the other items weren't significantly different in their factor loadings. And we found that when we excluded this item, this one item, because we still have a measure of kind of intensity and frequency of the thoughts in question 3, we found evidence for scalar or strong invariance, which means or suggests that if you exclude item 2 from our adapted tool, you can compare it statistically, the means between autistic to non-autistic adults, which is very, very useful for future research. We also found evidence for construct validity and test-retest reliability. We found that our adapted suicidality assessment tool in autistic adults was significantly correlated with the self-reported autistic traits, self-reported camouflaging of autistic traits, feelings of thwarted belongingness, perceived burden on others, current depression, current anxiety, and also highly correlated with the original version of the tool. We also found that scores at time 1 significantly correlated to scores at time 2, 2 weeks later. And finally, we split the sample into those who had reported that they had attempted suicide compared to those who have reported that they never attempted suicide using the first item of the original tool. And we explored whether the scores on our new tool could actually successfully categorize these two groups, which could be very, very useful for future research as well. And we found that 78.9% of people were correctly categorized, and an indicative cutoff to interpret what is a high score on this tool is around 12.5, which gave a nice, pretty good balance between sensitivity and specificity. So in discussion, that was 3 years of work trying to condense into 15 minutes. But in partnership with autistic adults, we have adapted a widely used tool, the Suicide Behaviours Questionnaire Revised, to better capture suicidality in this group. We found evidence in a range of measurement properties, building from the ground up from content validity, making sure that autistic people, autistic adults can interpret these questions and are interpreting them in the way that we envisage that they should. And importantly, through doing that, through working in partnership with autistic adults to develop a tool, we've actually found that this adapted tool for autistic adults can actually be used to compare scores between autistic and non-autistic adults, just excluding that item 2. It's also really important to acknowledge that this tool has been validated for use in research. We don't have any data on how useful this will be in clinical practice, in particular to predict future adverse events. And in fact, there's growing and mounting evidence that using short scales like this in clinical practice to make treatment decisions about who should receive treatment, who should be discharged, don't work, and they don't work in terms of predicting future risk. However, what this tool will be really, really useful is for in research, in comparing prevalence of suicidal thoughts and behaviours, and modelling and identifying risk factors, which will be really, really important to go to the next step of developing, as was said in the first talk, interviews and more in-depth clinical interviews to identify holistic risk factors for the person to help keep them safe. Another thing that I should mention is that this is an open source research tool. It's free to use, and it will be made widely available on our website as soon as it's passed through peer review, and you can always contact me to ask me more about it or to register your interest in receiving a copy. I'd also like to extend my thanks to everybody who's been involved in this research, because it's been a huge project with a lot of people involved from a number of different universities. And special thanks to the autistic people who worked in partnership with me and joined me on this journey to develop and validate this tool. Without the support, the really, really strong support of hundreds and hundreds of autistic people who spent a lot of time with me and taking part in this quite challenging research. Thank you very much for that, and to everybody who took part, and thank you for listening.
Thank you. Is there any question in the audience?
Hello? Can you hear me? I'm up here. All up? Yeah. Hi. I have two questions for you. Do you have, any plans for validating for clinical practice? And two, do you have any plans for translating it to other European languages?
We would really, really welcome translations. So if you are interested in translating this tool, then please contact me. We would only ask that after you've translated it, we can post it on our website and that you let us know if you publish any data from it. But yes, translations will be very, very welcome. As for validating for clinical use, yes, we would be interested in doing that. I think it's really, really important. In fact, one of the top 10 research priorities that were identified in partnership with autistic people for future suicide prevention research was to explore what are the best methods of assessing suicidal thoughts and behaviours in research and clinical practice. But we're at quite an early stage of the research cycle, so we're at the stage of developing this tool. We're working on another tool that could be more relevant for clinical practice and a holistic assessment to understanding the lead up and contributing wide variety of factors for why an autistic person is feeling suicidal and what could help that person stay safe. So once we've started to get a battery of these different types of tools, then we'll be looking at which ones might be best for use in clinical practice or what kind of combination of things could be helpful. But that's a bit down the road.
Thank you. I think we need to proceed.